How do you feel?
There she is.
There she is, Miss America. How do you feel?
Good.
Excellent. And again, no sedation. Wow, 2 in a row today.
Piece of cake.
Piece of cake. All right, so if we get the chair down, do you feel strong enough to, of course I'm going to help you, but do you feel strong enough not dizzy or anything?
Not right now.
Okay, just hang tight. Make sure this is down all the way. Then, oh yeah, take the booties off. And then go ahead and you can grab onto me once you get up, get situated. Okay, just make sure you feel okay.
Yes.
All right. There she is.
Waltzing Matilda.
This is some paperwork that we give everyone before they go. It's the medication that we gave you today. Well, local.
Oh, the local cane. Yeah. That's really. Well, we do give that to everyone, but it's not really, doesn't really have much on there.
Okay.
All right, here we are.
Oh, I know, I just threw it.
Give it up for her. Give it up. Can we cut Beth around?
Here?
Wow.
Beth, anybody will cut the...
Mind if I sit next to you?
Yeah, but what are you doing all day?
Filming.
It's right here.
How do you know what you're doing?
There we go. Okay. There you
Pretty much everything.
go. Okay, so for...
You look like my
I'm
grandson.
hoping,
Oh, yeah?
I'm assuming
He's 22.
that everybody could hear and see okay. I'm in there in my own little world. I don't know what you guys are seeing.
That was perfect.
Okay. Were people able to see it on the other side too?
Yes.
Okay. All right, good, good. Every year we're trying to make it a little bit better. For those of you who came last year, I think it flowed a little bit more smoothly this year in the videotaping. Both of our patients today did their procedure without any sedative whatsoever. I mean, she hasn't had any Valium, nothing. And this is the same with our earlier patient.
What did
So-
she have?
Yeah.
Well, what did she have? Scotch or something?
No, it was my singing.
Oh.
Comes from a lot of practice singing lullabies.
She was hypnotized.
Hypnotized. Do any of you have any questions that she could answer for you?
You want to sit on the chair, Becky?
Any questions at all?
Can you feel anything?
Just in the beginning, the little trick with the needle the first time.
Will there be a lot of
The question is how much bruising, and what I've learned time and time again is that it is unpredictable. Now, there are some things that we recommend to our patients to try and minimize bruising, and it definitely helps. And that is first and foremost to avoid any aspirin products a couple weeks prior to the procedure. You know, many people take a low-dose aspirin, right? That's common. I take an 81 milligram aspirin just from a health standpoint. But we like to get people off aspirin a couple weeks prior, ideally. Slightly less important would be if nutritionally, if you take any omega-3 or fish oil supplements or krill oil, we also like to get them off of that a week or two before. But again, that doesn't mean that you won't bruise. It's not a guarantee. It's just we're just trying to make an effort to try and keep it to a minimum.
How long will you have swelling?
Well, most of her swelling right now is actually the local anesthetic. Now, at 24 hours, that's when the peak of any swelling or bruising typically occurs. So this time tomorrow, she's pretty much going to know where she is. My gut feeling is that, gosh, I hate to predict because I kid you not, every time I predict, I'm always wrong. But I mean, if you saw the procedure, you saw that there was very, very little bleeding, right? And so I'm optimistic that she's not going to hopefully have a whole lot of bruising and swelling, but I can just tell you, hey, I mean, I did my wife's eyelids just about 6 months ago, and I'll admit she didn't have much bleeding either. And my gosh, by day 3, her eyelids, and no disrespect, right? I mean, I'm not trying to be a racist. I mean, some of my best friends in medical school are of Asian descent, okay? So I don't have any, I'm not anti-Asian, don't get me wrong, but I kid you not, that they were so swollen by day 3, my wife's eyelids, and she did great during her surgery, so it just re-emphasizes to me every time how I can never ever predict, and when I do try and predict, I'm always wrong. So as a result, I'm going to predict that she has a ton of bruising and swelling. That way I'll be wrong and she'll be great. Now she's going to have a little drainage, so right, that little kind of blood-tinged drainage. What that represents is the local anesthetic that I injected working its way out. But when it goes in clear. When it comes out red. Okay, so it's not that she's actively bleeding per se, but there is a little blood mixed in with the local anesthetic, and that's what kind of drips out for the first 24 hours, give or take.
Well, you look great.
Yeah, she does. I mean, that's amazing.
Oh, I'm sorry, I didn't see you. Yeah, and the patients come in for their preparatory visit, and I'm assuming you did, right? And we have an instruction sheet, and we do recommend the first 48 hours to do cold compresses, whether it be crushed ice, frozen peas, frozen corn, and gently put them over the eyes, maybe 15 minutes out of every hour while awake the first day or two, and that's helpful in reducing any bruising and swelling. Yes, sir.
Is this a procedure that may have to be repeated in the future?
The question is this a procedure that may have to be repeated in the future? I typically recommend doing it about every 2 weeks. In all seriousness, certainly, come on, that's a little Northeast humor.
Yeah.
I mean, certainly we do have those patients who have had it many, many moons ago, and we do it again. I mean, when a patient asks how long is it going to last, really what they're asking is, in my opinion, what they're asking is, how long is it going to take to get back to that same level? Now, to get back to her same level is going to take many, many years, 20 years. But what I do find is on occasion, I'll have a patient who, I may have done their eyelid surgeries 12 or 15 years ago, and now they're starting to get a little bit excess skin, but they know what it's like, so they don't want to wait until it's back to the way it was. They want to attack it sooner. So on average, when people ask that question, I mean, it could be, I guess, theoretically, touching it up as soon as 6, 7, 8 years. More commonly, it's usually 10, 12, 15 years. Depends on the individual and how they continue to age, right? It's their own genetics of how they age.
Are there any possible negative side effects you could have?
The question is, are there any possible negative side effects? So I'm going to couch that answer in 2 ways. There's the technical answer, which is, for example, if you were to research or Google something about side effects of blepharoplasty, right? That would include, hypothetically, this has never happened. I mean, I've literally done over 15,000 of these. The worst situation that we've ever had is someone who breaks their stitch afterwards, and we just have to re-stitch it. Okay, that's the practical answer. However, to answer your question, because I'm not trying to evade your question, sure, could somebody lying on the table, could they have a stroke or a heart attack? Right? Okay, number 2, like you saw me put in those little metal shields, right? Now, even in the, what I call the old days, when I did my training where we didn't have laser, we were always trained to use shields. Okay, even without the laser. That's how our training was. So we do that as a precaution, hypothetically, to not injure the eye. Now, I've been using that, not that same laser, but I've been using laser for blepharoplasty, as I said, since the mid-90s, and I'm proud of the fact I've never misfired that laser once, right? But theoretically, right, if you're not paying attention, you step on the pedal and you're pointing at someone, that's why everyone in the room wears goggles. special goggles that protect from the laser, so that if I were drunk, even though I don't drink, but if I were drunk, and I fired that laser right at your eyes, that it would bounce off the goggles. So realistically, in terms of having eye damage, that's a risk. Practically speaking, that should never happen. I mean, it just should never happen. You know, I mean, it never happened once. I can say that, you know, look at you in the eye and tell you that, because it just shouldn't happen. And any other questions? Yes?
You mentioned not taking aspirin. What about other NSAIDs like Celeron?
When it's NSAIDs, it's a good question. You know, aspirin and non-steroidal anti-inflammatories are a little different, right? So non-steroidal anti-inflammatories include your ibuprofen, Motrin, Advil, Aleve, naproxen, naproxen, blah, blah, blah. Celebrex, right? So those are a little different. What I generally tell the patient is if you can go 5 to 7 days prior to the surgery and substitute it with Tylenol or acetaminophen, fabulous. Okay, the NSAIDs, the duration of blood thinning is much shorter than aspirin. The platelet aggregation effect of aspirin technically actually lasts for about a month. Now, we never have anybody stop it for a month, but it's a long time. So for the NSAIDs, we stop at 5 or 7 days if they can. But I tell the patient, look, you know, if you're needed for your arthritis or what have you, and you're going to be a cripple, it's not worth it, because, you know, you're not talking about a big deal. Okay, so you might have a little bit more bruising or swelling. What's the big deal? I'd rather that you feel comfortable and feel good and not be crippled, right?
And how soon after?
24 hours later.
You can start.
Right. Now, if a person's on a true blood thinner, depending upon what that blood thinner is, right? If there's Coumadin, which is warfarin, right? Warfarin and Coumadin, that we stop anywhere from 2 to 3 days prior, with, of course, their doctor's blessing. If it's like a Plavix type medication, it'll be anywhere from 3 to 5 days, maybe a smidgen longer before. But we don't try and stop it way long before, just a few days. And that typically, you know, believe it or not, as crazy as it sounds, I really have very little concern about the warfarins and Coumadins and Plavix and Eliquis and Pradaxa. The aspirin is what makes people bruise the most. Yes, with that little 81 milligram aspirin that we really like to try and stop. Yeah, you would think it would be the blood thinner. I see it time and time again, it's the aspirin.
Interesting. What about, does it ever affect the tear duct when you do those injections?
No, the injections don't go anywhere near the tear duct.
Just curious.
Yeah, no.
That's good. Say it out loud.
Yeah. Great job. Let's give her a hand. Great job. Let's give her a hand.